Hello, everyone, and welcome to another episode of Uncommon Conversations. I'm your host, Carly Bonar, and today we have my friend, Lauren Trimeloni, who is a lot of things in the world. A mother of six, an obstetrician, a pediatrician, an amazing superhero in our community. So,
thank you. That's an introduction.
yeah. Do you want to tell everyone a little about yourself?
Yes. So as Carly mentioned, I am a medical doctor. My technical specialty is family practice. So I encompass obstetrics, pediatrics, a lot of women's health. My first job, of course, is mama to my 6 kids, which I love. And the first 4 of them are girl babies. And so women's health follows me home on a regular basis. And we have lots of talks about the cycles and rhythms and all of the things that make us women, right?
Yeah. Which is how we met,
Mm-hmm.
you know?
Yes, absolutely.
Can I talk a little bit
Absolutely.
about that? Okay. So when I met Lauren, she came in as a client and I was going through it. I was postpartum, which is what we're going to be talking about today. And during that time, I thought I was losing it, and you helped me to feel normal. You're like, this is totally normal.
Right.
Nobody talks about these things, you know, but you did. And that was, yeah, changed my life. So tell me a little bit about postpartum concerns and care for women.
Oh, there's so many. So I think for a lot of us, we decide to have a baby. Sometimes we don't decide to have a baby and we have a baby anyway. But we become pregnant, and a lot of people have even educated themselves about preparation for pregnancy, nutrition, exercise. There's not a lot of really easy ways to find out how to take good care of yourself after the baby.
Yeah.
Pregnancy hormones, in reality, hang around in your body for about 4 years after pregnancy, and to different amounts. And the change in the first probably 6 weeks is so dramatic after birth, or after miscarriage, after any type of pregnancy conclusion. And I feel like the focus at that point for most families is on the baby, or on the lack of a baby, right? And and then no one, I think it kind of leaves you guessing in your mind, like, am I losing it? Is this something normal? Postpartum depression, I think, is one of the more commonly recognized disorders, right? Where after a pregnancy, where you do get stuck in more of a depressive pattern. There's also anxiety, there's also rage, there's also, there's so many different ways that your emotions can get out of balance. A really big part of that, I think, for a lot of women is the resisting of the wave, right? Because you have a baby and your body is just changing minute to minute in its hormonal balances. If you were lucky enough to complete a pregnancy and keep the baby, then you're breastfeeding, you're not sleeping, your body's depleted. And while that's going on, you're running through emotions minute to minute. Can I do this? Am I good enough for this? Do I, this baby's perfect and I don't know how to take care of it. What does that say about me as a mom? And other people know how to do this, right? Like, I don't know how to do this uniquely, but other people definitely know, and they're going to notice, and somebody's going to take this baby away from me. You think all kinds of thoughts, and every thought we think triggers an emotion in our body. And pretty soon, women think they're nuts. And that's even women that don't meet a diagnostic criteria for postpartum anxiety, postpartum depression. You're just sitting there and you're doing the best you can, and you're either formula feeding them and beating yourself up, or you're breastfeeding them and beating yourself up, and you're questioning, do you have them in the right kind of sleep, or are they in the right kind of bed? Right. All of this. And I just think, I don't know, I think it's a topic we all need to spend a little bit more time on, so women know they're not alone.
Yeah, thank you. Thank you. For me, meeting you was you know, a godsend, because I think part of the reason why we don't know how to ride the wave is because we're not really told that there's a wave. It's like, for how long have women been, you know, diagnosed with many different things that
Right.
say they're, you know, quote, crazy, because
Absolutely.
they're having these extreme highs and lows. And so you actually busted a myth with what you said earlier, because what I read recently and told a couple of people that in my reading, 7 years
Nice.
is what they say postpartum, like,
Right.
you know, the turnaround. So I wanted to ask you, and you said around 4, but
Right.
for me, my postpartum lasted so long.
Right.
And probably the worst of it was around that 4-year mark. So
Right.
it's so interesting how it can differ
Right.
for so many people. And we're not told what to expect, or that we can even expect it for that long,
Right.
you know?
Right. Absolutely.
So it kind of takes you by surprise,
Mhm.
you know? And I think, you know, one of the things I wanted to talk about too was leading into this topic of like, when this happens, everyone around us, to everybody else around us, it does look wild,
Oh yeah. Oh yeah.
you know, and so family members don't know how to handle it. We don't even know how to handle it because we're not taught. So then,
Right. When in your parenting journey, in your mothering journey, did you ever find yourself saying don't cry to your baby or to your 2-year-old or to your 4-year-old, like when they were upset or
more like shh, shh, shh,
yes, exactly.
shh, yeah,
Yes.
yes.
And I think our loved ones, people that are trying to support us, even they don't mean that to be the message,
Right.
right? But that's the message. They see pain. They're like, she's in pain. Let me fix it. Don't be, everything's okay. Everything's okay. You don't need to be upset.
Yeah.
Right.
Yeah.
And then you're like, I don't need to be upset. Something's wrong that I'm upset. I should not be upset. I'm going to fake it. I'm going to look less upset. Right.
Yeah.
It's just this game that we all play as humans. And I don't think anyone's meaning to.
Right.
Right. But it's like minimize, 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 hide it, keep it in.
Yeah.
So I could see 7 years. I have the studies on the length of time are so difficult to do, right?
Yeah.
Because it's not like it's a blood test. It's not like we can just measure it and say, definitely by this time it's gone. And the real message is so much longer than what we're hearing in popular culture. Yeah.
Yeah. I'm also curious around, because for me, in my experience, reflecting back, maybe not in the moment, reflecting back, it was like pivotal in spiritual awakening for me, this pivotal turning point of like waking up to who I was as a woman, what I was stepping into, being asked to step into, and what it truly means to be a mother, and how much that influences every little thing in our life, and just all of this waking up at that time. And I'm curious around, you know, your thoughts on, can these two things, are they simultaneous? You know, like what we go through in postpartum, mental health versus spiritual awakening, and is this one and the same in your assessment?
You know, that's a very interesting question. I've not previously given that specifically a lot of thought. What came to my mind as you were asking was a professor that I worked with in college who told me one time that she and her husband had decided to have a child. And at the time, I think he was about 2. But she was a little bit older when she became a mother for the first time and the only time. And he was a good bit older than her. I think he was in his 60s and she was getting closer to 40. And she said, you know, we had everything really under control, and we were both very religious, and we felt like you know, the only thing left to get closer to God was to make a child. She goes, because you're never as vulnerable or out of control as in parenthood. And I was probably 19. So at the time I was like, right. I had no idea what she was talking about.
Right.
And, but I remember that all these years, because I think now like 100%, right? Because you can't you can lose just about anything,
Mhm.
right? And until you're a parent and you really think about what it would be like to lose that child, it's a completely different experience. To the idea of the postpartum sort of, roller coaster or storm or whatever, however you would describe it, and a spiritual awakening, I do think that there's something to be said for, we live in a society that labels emotions that feel bad as negative.
Yeah.
And there's a lot of what's happening that is a very important part of the bonding, of the transformation into parents, that is very likely tied to those. For people who have a male partner with them when they're entering into parenthood, and in any two-parent situation, regardless of the gender of the other parent, one person is going through the hormones, right? And one person is not, if one of them was the birthing parent. And it's amazing to watch. There are still chemical responses and hormonal responses in the non-gestational parent. And they really think they're nuts, right? Because they don't identify at all that they were involved or that anything should have changed. So I think I think all of it plays a necessary role, including the roller coaster. For a lot of years as a doctor, I'd prescribe a lot of SSRIs, and I still do.
Yeah.
I'm not, they play a very important role in this, but it's amazing how when you learn more and you study more about it and you really provide people with that support and counseling in advance, how rarely they actually need the medication.
Yeah.
The medication's wonderful. This is not, I'm not saying not,
Right.
but it's the same. It's almost like somebody comes in and they say, I'm a little anxious. And I'm like, would you like some Zoloft?
Right. Which happened to me. So right after Millie was born, let me think, 6 months, I was prescribed Zoloft. It sent me into horrible depression. It went the other way for me.
Yes. It's definitely, it's a mixed bag, and especially because we're treating something so different, right? When your brain's in this cascade, I always encourage women to keep medication on the table as an option, and to discuss it and think about it. And if you decide to try it for the length of time it takes to notice if it's helping, right? And to be willing to pivot if it isn't.
Yeah. No, I heard you almost say meditation. Maybe that's
meditation is way more. I know. I recommend meditation all the time. If my patients were listening to this, they'd be like, "Oh yes, that's the yoga doctor, the meditation doctor, every visit."
But that's what I love about you,
because you meditate.
Yeah.
Oh, you can't sleep well. Do you meditate? Oh, you feel anxiety. Do you meditate? You want to lose weight. Do you meditate? They're like, what is it? Like, is there anything you don't think this fixes? No.
It's the best way to start the day, tuning into yourself, 100%. Understanding which way to move next,
Oh, 100%.
And I love that you blend that in your care for women. It's so important. I think
it's necessary. I really do. The blend, I think you have to blend all of the knowledge.
So I have kind of a juicy question for you. Can you talk about, since you're a mom of 6,
yes,
can you talk about your postpartum experience a little bit, and how you can see anything you went through in yourself that you see in patients, and maybe what's some, like, a common thread for postpartum, what to kind of look for? And
so after 3 of my babies, could have identified myself as having postpartum anxiety. With my first baby, 100%, I should have had myself diagnosed and treated. I was doing a little bit of therapy, but when do you less have time to go to therapy than with a newborn? And I had truly intrusive, vivid pictures and thoughts of just terrible deaths of my partner leaving for work and dying in a horrific car accident. And I could see it. Like I'm saying goodbye and I'm like, well, it's the last time I'm going to see him.
Yeah.
And I have like a 3-week-old, and I was always worried I was starving her to death. She was slow on her growth curve with the nursing. So my milk supply was low, I told myself. And while she developed like fantastically, I was like, she's clearly not getting enough. And I remember my mother saying to me, I'm worried. I'm so sorry. I didn't even realize that's on. It's okay. My mother saying to me, I'm worried you're not enjoying motherhood very much.
Mm.
And I'm thinking, like, enjoying? I'm just trying not to kill it. Like, I don't know, like, she's so perfect and I'm so inept for this. Right?
Yes.
And and then I got pregnant and I had another baby, and I really don't remember struggling the same way. I remember, but there were a lot of differences, and I've had a 2-year-old and a newborn, right? So I was more, I don't know that I had time to think about whether or not I was struggling.
Yeah.
A couple of my births were easy, had the baby, brought the baby home, waited for the crash. It didn't come. Nursed the baby, didn't worry. It was like, this is so strange. Like, have a baby and be fine.
Which number were you on at that point?
That was number 3.
Okay.
And then number 4, I remember, I think I did Zoloft for a little bit. I did a little, stint of something. My number 5, it was fascinating. I had a little gap between them. I was 41 years old when he was born. And he was born on St. Patrick's Day of 2020. And so the whole world shut down, right? And I would sit alone in my bedroom breastfeeding this baby. All my other kids were off school now because everybody had to be home. And I would cry while I was doom scrolling the news stories about COVID, because as I had been watching the alerts coming while I was pregnant, was like, I am so glad that I will be on maternity leave while everyone sorts out this pesky little pandemic issue, So, because by the time I go back in 12 long weeks, this will all be behind us. And then I'm reading the stories and I'm just crying and crying and crying. And I was anxious, and I was, just probably similar to what everyone else was going through, but with postpartum on top of it.
Yeah.
And I did my 6-week visit with my obstetrician by telemed, and we're on the phone. She was like, are you having any trouble with anxiety? And I'm like, oh no. No. I mean, I cry every day, but I mean, everyone's dying, and I just went through it. And as I was saying it out loud to her, I've talked to so many women that are like, I'm not having a problem.
I was like that.
And they're crying.
Yes.
And their partner's like, she won't take a shower. She won't lay the baby down. She won't go anywhere. And, the baby's fussy, and and I'm like, okay, so, you need to shower.
Yeah.
And she's like, I know, like mad, right? And I'm like, no, I'm not judging you. Like, wait, but when you feel like you can't lay the baby down to take a shower, or you can't let anyone else do anything, or you can't bond with the baby, right? Because you don't want to look at the baby. One of the best screening questions for postpartum anxiety and depression is motherhood what you expected? Because a lot of women, even when they're very in denial about having a problem, they're like, no, this isn't what I expected.
Yeah.
This isn't what I thought. And I think for me, it was interesting to see that play through my mind. Certainly when I had my oldest, I had been a doctor for years already. I'd treated postpartum. I had diagnosed postpartum. I knew nothing. I didn't catch it in myself.
Yeah.
I white knuckled it until I had another pregnancy.
Well, I don't think, what I want to say is, I think it's so common that we don't see our own,
right?
No matter what it is that we specialize in, we have that blind spot, and it takes another person to say,
yeah, you don't seem like you, right?
Right.
And
right.
You don't feel like you don't feel like you.
Right.
But it feels justified. It feels normal. And I think because parenthood is a struggle, I think that it's easy to blame the struggle, right? Like, so yes,
Yeah.
I'm tired all the time, but of course I am. I have a little baby.
Yes.
Yes,
Yeah.
I'm worried a lot, but of course I am. I have a little baby, you know,
Yeah.
and I think that that's a big part of the increasing the dialogue is to help women feel empowered to speak about it without feeling like they're a bad mom if
Right.
they have negative feelings about motherhood.
Right.
And also to start to make it easier as a whole society to tease out when it's a diagnosis, right? When is it a problem where the person needs help? Because it's always a problem where they need support, right?
We
need
all
to
need
help each
support.
other.
Yeah.
Other cultures, they don't have newborns like this. Like you have a newborn with a village.
Yes. Yes. Well, I mean, they say this, it
Yes.
takes a village, yet everybody sort of goes their own
Mhm.
way. They don't want to be.
Right.
And I've been fortunate in my life with my kids. I had a lot of family and friends that wanted to contribute, you
Mhm.
know. But definitely not like other cultures I see, you know,
Right.
and it could have been a little easier
Right.
had it been noticeable. But since it's not widely talked about, like these are the things to look for in a family member that just
Right.
gave birth,
Right.
you know.
And I think normalizing is very
Mhm.
important. I think it helps women, you know, you kind of said it in your experience meeting me, right? I was able to verbalize what you were going through.
Yes.
And then you felt less alone.
Yes.
So
Well, you also connected it to your own story. So you and I became quick friends over this, you know, like this is happening and you would share with me, or, you know, when you were going
remember
through
when I
it.
was pregnant with the boys?
Mhm.
I was like, well,
Mhm.
I'm a nutcase. Hi, I'm a nutcase.
Yeah.
I'm a nutcase today.
Yeah.
I'm a nutcase. I hate all people. And I have 25 patients to see and I have to be nice to them.
Right. Or you would send me the pictures like during COVID, whenever you were going through it,
Yes.
of you breastfeeding, and it was like this beautiful image. And you're like, by the way, I'm crying. There are tissues all over the floor. I hate my life. What is happening?
Right,
You
this
know?
is terrible. Yeah, no, it's true. It is true. It's
Yeah.
so intense.
It
you
is
know?
so intense. And you were very real about that. And that's, you know, well, that's why I keep you around. Good friend. No, I admire who you are as a person, your abilities to really give your love to so many. It's so beautiful to watch. You're a mother to your own kids, but you're a mother to the community and you help people mother, and it's wild to watch you.
Oh,
Yeah, it brings up a little tear for me.
I'm like blushing. Like
It's
thankfully it doesn't show in a podcast, but I'm like,
yeah, you're beautiful to watch, and it's so comforting to know that you're part of
oh my
our little
gosh.
community.
Thank you.
Yeah.
Thank you for saying that.
Yeah, it's really true.
Oh,
It's really true. You
so
touch a lot of lives. And hey, my child loves you too, because you're also Millie's pediatrician.
true. Right. Yes.
When
Which
we
I'm not
got-
allowed to say, but she's allowed to say.
Yeah, so when we got the letter that you might be
Mhm.
taking some time off, it was, I mean, Millie was like, I am not seeing another doctor. There is no way I'm seeing another doctor. Like,
She's
okay,
like, that's absurd.
it's absurd. Who would put me in this kind of position?
Oh my gosh, and that's excellent. Yeah, the letter she's talking about, we sent out because we were transitioning my focus from a little more primary care center to actually the mother baby program is what we
Right.
call it. And
Yeah.
it is, it's, you know, so that's our whole focus is on improving the care of mothers and babies and just treating them like a unit longer, because we also tend to cut the cord at the end of pregnancy and then you just get flipped to two separate doctors.
Yeah.
And, you know, and so we're trying to kind of bring a medical home back for both so that that care is congruent.
I love that. I love that. It reminds me of, you know, because I gave birth at the midwife center with Millie, and I also had a doula, which I highly recommend.
Yes.
There was so much support. I felt
Mm.
very, very supported in that room. And so the doula then did aftercare, home care for me for a while. So it was, yeah, very fluid, very fluid. I'm glad.
Doulas in medical studies have been found to decrease the need for medical interventions all around. You know, so they, you know, your labor support person comes to the hospital with you. They're trained. Typically, they're women that have given birth,
Mhm.
and you know they're with you the whole time, and it just changes your fear level.
Yeah.
You know, it changes how you interact. And we know when your body's in a state of fear, it's releasing different chemicals.
Yeah.
Right. It changes the physiology of birth.
Yeah. For me, so Robin was the name of my birth doula, and she was so supportive. I fell asleep, and I had a really hard labor with Millie, and I was very nervous because she couldn't break through my cervix. We were just having a tough time. And Robin just so easeful. So it made it so easeful. I fell asleep. You know, I'm breathing and breathing, and the fear starts to leave me. I highly recommend the doula experience. They're well trained, you know.
Yeah, absolutely.
Yeah.
And they're good. They're good in a hospital setting. They're good in a midwife center. They're good, you know, they're good anywhere. It's amazing.
Yeah.
So,
okay.
Excellent.
Are there any other things you want to say before we wrap up? Another myth or about postpartum that you want to?
No, I guess I guess I would just want to encourage everyone to talk about it. Like, tell people how you're feeling. Tell people, you know, talk to your friends, talk to your female family members, talk to, you know, anyone, because they have likely been through something similar.
Right.
And even, you know, if you have a particularly hard time and you didn't get help in the moment, right? You can create that help by discussing your experience now.
Yeah.
Because we can close the gap on this.
Relating. Yeah,
Right.
relating
Right.
to other people, you know, humans first.
Right. Right. Oh, absolutely.
Yeah. Well, thank you. Thanks for all of your wisdom and for coming on and hanging out with me today.
Well, thank you for having me.
Yeah.
Pleasure.
All right, everyone. See you next time.